Good to see you.
Good to see you, Professor Gordon-Smith. You're a legend in this area of aplastic anemia.
Oh, it's very kind of you to say so, Austin. But in fact, it, as it were, fell into my lap to become interested in aplastic anemia when I first went to the Hammersmith Hospital.
Okay. Can you tell us a bit more about it? Because I'm always fascinated with history, how people get into particular areas and specialization.
Well, when I went to the Hammersmith, there were almost nothing known about aplastic anemia, but Dr. Mitch Lewis, who was the senior person there, was interested in patients with pancytopenia. That's to say, anemia, as you know, anemia and lack of white cells and platelets, of which there were a whole host of causes. So our first job, as it were, was to try and sort out what we now call aplastic anemia from these other conditions like myelodysplastic syndrome and so on. And this was a question of cataloguing patients and, as you might imagine, collecting data on them. We were greatly helped at that time because the only possible treatment for such patients who didn't have leukemia but had pancytopenia was to use testosterone-like drugs, anabolic steroids, and those came from a pharmaceutical firm called Syntex, which was present in Maidenhead, who had an anabolic steroid which had less of the effects of testosterone but built up muscles, and it was known from some work in America that these might help with anemia, so that we were able to publish one or two papers about, first of all, what aplastic anemia was. That was Mitch Lewis's main thing, and secondly, was there any advantage of using anabolic steroids? And there was some advantage, indeed. In 1973, as a matter of fact, we from the Hammersmith went over with our results to meet the people from Seattle in New York to discuss the treatment of aplastic anemia, and was this new startling treatment of transplantation better than oxymethylone? We met up with some of the people who had been there in Chicago with Bruce Committer, who was a very enthusiastic trialist for these things, and he set up the first trials of anabolic steroids and support, of course, blood transfusion and so on, better or as good as transplantation for people who had a donor. And of course the paper then came out in 75, 76 something, which showed clearly that transplantation had big advantages over anabolic steroids or oxymethylone, providing you had a donor. And that was the beginning of it. And then we came back in Hammersmith and started the transplant program.